Okay, good morning, everyone, and welcome to this second day of our Horizon Europe Program 2026-27 webinar series. And what better way of starting this week with a webinar on Cluster One, the health cluster. My name is Lasse Wolders, and along with my colleague Emma, I am the health NCP, also program committee member for Cluster One Health. Just before we dive into today's webinar, just a few housekeeping rules here. We are, of course, recording this webinar, and we will make sure both the recordings and the slides are available to you afterwards. Your microphones are muted and cameras are turned off. You are, of course, very welcome to use the Q&A function to ask your questions. We will try to answer them as we go along, but also we have a tight schedule. We have to finish by 10:15 to make room for our colleagues with the next clusters. If there are many questions, we might have to get back to you afterwards. Any technical issues, any comments, you can use the chat for that. So let's dive into it. Today we will, in the next 45 minutes or so, we will talk about, of course, the work program 26-27. We are looking at some of the main novelties for this health cluster work program. Also, an overview of the structure of the work program, talk about what is new for this kind of structure, and then also we will be looking into the 6 destination that comprises the health cluster work program. We're not gonna be going into detail on each topic. There's no time for that. So we are looking mostly at the destinations covering all these topics. Lastly, also we'll be talking about some of the cross-cutting issues in the work program and, of course, one of the main policy agendas behind it, the European Life Science Strategy. We didn't include it on this agenda, we also have invited a guest speaker today, Pablo Penisi, who's associate professor in regenerative medicine from Aalborg University, has kindly agreed to give you all some insights into his application and proposal submission process in obtaining a successful proposal. So hopefully Pablo will be able to give you some good ideas and pointers on how to go about writing your proposal in winning some of these projects afterwards. So this is what we will be covering in the next 45 minutes or so. And as mentioned, any questions you may have, please use the Q&A, and we'll try to answer as we go along. So firstly, of course, the health cluster is part of Pillar 2 of Horizon Europe. Last Friday, we already covered most of Pillar 1 and some of the cross-cutting issues. Now, today, we're looking into Pillar 2. And it is all about supporting research and innovation in improving health and well-being for EU citizens, also beyond, of course. And most of the content of this, or all of the content of this work program is based on the Horizon Europe strategic plan for 25-27. So this is the overarching strategic planning on how the 2 work programs in this strategic plan have been outlined. In the webinar last Friday, there's a bit more information on this, and you can tap into that as well. Some of the main novelties. This is not something that is exclusive for Cluster 1. This goes across all the work programs for 26-27. The idea behind it is shorter, simpler, and more strategic. This, in essence, means that we are looking at fewer topics across the Cluster 1 work program. Fewer topics, and the topics that we do have are supposedly to be less prescriptive. Of course, this is the overarching ideas going through the work program. So it doesn't mean that you will, for all topics, you will probably not see this, but this is the overall idea. So it means that less prescriptive means that it's more open for different ways of achieving the expected impact and outcome. So there has, as mentioned, Emma and I are also members of the program committees, and a lot of the discussion there in developing the work programs have been about the level of how descriptive especially the expected impact and outcome have been. So there's an attempt here to make it more open for as applicants, your interpretations of what are the main issues that the topic should cover, and how will you propose solutions to these issues. So it means that it is more open. It's not entirely, of course, it's not entirely bottom-up topic. There are still quite specific issues to be covered. There's quite specific expected impact within this. The idea for the topic description is also that it should be maximum of 2 pages. There are several exemptions for this, you can say. If there are specific cross-sectoral issues, there has to be room available in the topic description to describe this. So this may mean that it will go above the 2 pages. Also, clinical trial, of course, is for many of the topics in cluster one is a key aspect of a project. So clinical trial schemes can take also up quite a lot of space. So the overall idea when you're looking at the topic is that there are a few topics that we've probably seen before. There is more room to develop own solutions within a set frame. You will, however, see for some topics that the topic description may be as long or even longer than you've read before. This is the nature of some of the topics that are in there. We are also looking at a larger average grant size. So across the clusters, we are up to 10% larger projects. And this, of course, doesn't mean necessarily that consortia should be larger as well. Again, it's very much up to you as applicant to frame the projects within the topic description, and also to set up the consortia that is most suited to cover these things. And of course, in your proposal, to argue that this is the best setup. So the end goal for all this, of course, is to also secure larger grants per partner. But of course, the consortia setup is entirely down to how the topic is described and how you see fit. The budget we have for this 2-year work program is divided, of course, across the 2 years. So we have 611 million euros for 2026 and 723 for 2027. There have been, in the development of this program, and this goes again for all the clusters, there's been you could call it taxation for some of the big cross-cutting activities. So the budget development have shifted a little bit during 2025, when this work program has been developed. Not as such a novelty, but lump sum, of course, and two-stage funding continues to be used. There's been it's a political will to towards the end, so towards the end of 27, to have at least 50% of the budget set aside for topics that have lump sum funding. So there's a continuation of this in this work program as well. We have 16 topics that are flagged for lump sum budgets. Many of this, of course, is connected to two-stage calls. And within these two-stage calls, we also have 4 of them that are flagged for blind evaluation. So this, of course, means in the stage 1 proposal, it cannot be disclosed to the evaluators who is the consortium behind the proposal. At stage 2, when you make the full proposal, of course, blind evaluation is no longer a part of the proposal. So these are not as such novelties, but it's a continuation of what has been already a few years ago been set up as a goal for the European Commission. Now, the structure of this work program. as mentioned, is revolving around the 6 destinations. We'll go into them in a little while. In total, we have 38 topics across these 6 destinations. Most of these are the usual research, innovation actions, and so on, CSAs as well. We also have one topic that's co-created with the Ocean Mission. This is one of those cross-topic issues. We have a few topics where it's either already set aside for partnerships. Some of them are top-up, so not as such available topics for new applicants. It's expected that these partnerships will continue. We also have a host of other actions, which is predominantly set aside for already identified beneficiaries. So these are presidency conferences, just like the ones we've had in Denmark in the past 5-6 months, and also a few other initiatives that have is to be funded from the Health Work Program. So this is the structure as we know it. As such, this is not really new. It's a 6 solution that was the same in the Work Program 2025, and also quite similar in from the strategic plan beforehand. Sorry. Just check here. The implementation, of course, of this work program is coming from the strategic plan. And this work program is the final installment of the Horizon Europe cluster. So this is the last 2 years of Horizon Europe, as we know. And then we'll see what the next Horizon Europe will bring. All the areas, all the 6 destinations are meant to address the remaining gaps within the health area and the future needs that's outlined in the strategic plan. It, of course, aligns with a host of strategic and policy initiatives. The predominant one is the European Commission political guidelines for 24 to 29. But also, of course, some of the main priorities within this is healthcare resilience, leveraging biotech and AI. And for this work program, as you will see also when we go through the destinations, is that European Life Science Strategy that was published earlier this year is, of course, the very predominant strategy behind most of the topics going through this work program. I really urge you to look not only at the specific topics that you are interested in. The work program in itself of a very quite long and in-depth introduction to the main priorities. And of course, these are things that you should have in the back of your mind when you start reading your topic. The topic text is of course the frame from how you should make your proposal, but it builds on a number of different strategies and political priorities that you should know about as well. And with this, I will leave the floor to my colleague Emma.
Yes, good morning. I will continue with a deep dive in Work Program 2026-27, the destinations. And we will begin with Destination 1, staying healthy in a rapidly changing society, which is the first thematic area within Cluster 1. That focuses on research and innovation that helps citizens of all ages stay healthy and independent despite the major societal changes like demographic shifts, lifestyle risk, and emerging health challenges. The goal is to support health promotion and disease prevention by generating new evidence, methods, and solutions that leads to healthier behavior, environments, and policies. Projects under this destination aims to improve understanding of health needs across the life course and foster innovation, accessibility, and equitable approaches to prevent disease, enhance overall well-being, and reduce health inequalities. Some of the key aspects of the destination is to focus on healthier lifestyles, disease prevention and rehabilitation, It emphasizes on resilient health behaviors and reducing future disease risks. And the calls include behavioral interventions, trust building, and trust building in science, health literacy, and early detection research. One of the key approaches in the new work program is the new emphasis on the holistic approach that combines lifestyle, environmental, and social determinants of data-driven insights. In Destination 1, there is a total of 3 topics. There are no topics with lump sum funding, and there are no topics with blind evaluation. There is a quite small budget for this destination in relation to some of the other destinations, with a total of approximately 62 million euros. There are 2 RIA topics, 1 CSA, and we expect that there will be a total of 10 projects funded. This will be presented for all of the destinations. We will shortly present which topics of the destinations there are related to support the life science strategy. We will come back to the life science strategy later, but just to mention shortly that a lot of the topics in the work program of the health cluster is supposed to be supporting the implementation of the life science strategy. One of those topics that are supporting the life science strategy is the topic 3 in the destination, that is building public trust and outreach for the life sciences. We expect there will be 7 projects, and building public trust is one of the key areas in the life science strategy. So that's why that they have decided that this will be an implementing tool for the strategy. Then we will move into the Destination 2, which is living and working in a health-promoting environment that focuses on understanding and reducing the health impacts of environmental, occupational, and societal factors. The destination supports research and innovation to prevent disease linked to pollution, climate change, workplace risk, and unhealthy living conditions. It promotes the development of safer, more sustainable, and inclusive environments by addressing environmental and occupational exposure, improving risk assessment and prevention strategies, and supporting policies that protect health. Its overall aim is to enable people to live and work in environments that actively promote health, well-being, and resilience, while reducing risk inequalities and environmental health risks. Calls under Destination 2 encourage climate change-related health research and system resilience. Moreover, there is a very strong link in this part of the work program with the EU green transition priorities, for example, climate change, adaptation, and environmental sustainability. In Destination 2, there is a total of 5 topics. There is 3 topics that have lump sum budget and 0 topics with blind evaluation. There is an approximate budget on 168 million euro, divided on 3 RIA topics, 1 CSA, and 1 PCP topic. We expect that there will be funded approximately 22 projects in total. All of the topics in Destination 2 supports the life science strategy and is a part of the implementation. The core focus in the strategy is, among others, to have a very holistic focus on a holistic view on health and climate, which is a key part of the Destination 2. You can see how it distributes here on the slide. Lastly, I will shortly mention the Destination 3, which is tackling diseases and reducing disease burden. The destination focus on improving the prevention, diagnostics, treatment, and management of diseases across the life course, with a particular attention to non-communicable diseases, rare diseases, and complex chronic conditions. The destination supports research and innovation to better understand how disease mechanisms, advance personalized and precision medicine, and develop innovative therapies, diagnostics, and care pathways. The destination aims to reduce morbidity, mortality, and disability, improve the quality of life for patients, and ensure more effective, sustainable, and equitable healthcare systems in Europe. The call addresses also pandemic preparedness, long-term post-infection conditions, and sex and gender-specific disease mechanisms. There is a special focus on pandemic preparedness, pandemic lessons, and the need for integrated disease burden reduction strategies. In this destination, there is a total of 15 topics, 6 with lump sum and 2 with blind evaluation. There is a very large budget on almost 611 million euros. That is why, which is why there is 2 very large partnerships of phase 2, the pandemic preparedness and the rare disease partnerships, which is funded under this topic. There is 12 RIA topics, 1 coordination and support action, and the 2 co-funded projects. We expect that there will be funded about 61 projects. There are in total of 4 topics in this destination that supports the life science strategy. The first one is this topic 1, innovative healthcare interventions and non-communicable diseases. There is then 2 more, the 2 partnerships, rare disease and pandemic preparedness, and the last one, clinical trials for advanced innovative interventions for neurodegenerative diseases. Especially the last one with clinical trial has a large focus in the life science strategy, why it's an important topic. And then I will give the floor back to Lasse.
Thank you, Emma. Yes, so let's move right along to Destination 4. Destination 4, of course, is very much about healthcare systems. And it means system as a very overarching approach. It's some of the impacts around this should be both for health and social care providers, services and systems, but also healthcare providers, the training and the equipment of these in making the systems more equitable, more efficient, and responsive. Also, citizens in this play a key role. So both patients managing their own healthcare, but also the families, the people close to citizens that can play a role in this as well. Of course, also healthcare policy and systems is a key part of this destination. So the emphasis really is on the sustainability and the equity and centered around people, and people being both patients, being healthcare workers, and being next of kin. For this destination, we have 4 topics in total. One of these is a co-funded partnership. 0 of them are coming with lump sum budget, 0 with blind evaluation. Budget set aside for this is around 110 million euros. And this, of course, means we have 2 RIA projects and 1 PPI, so public procurement. In total, we expect 13 funded projects. I'm not going to go into all these different topics here. We have to move things along, so we also have time for Pablo afterwards. But you can see, just like Emma showed you, there are also topics within Destination 4 that are directly supporting the life science strategy. Next destination, Destination 5, is all about technology and digital solutions. So it's the tools, it's the technologies, it's very much surrounded, about AI as well. It is really about the impacts within these projects should be about developing or increasing European scientific and technological expertise, know-how, capabilities. Of course, all this is in the increasing competition with USA and Asia especially. But also that citizens can benefit from both targeted and much faster research. And an approach where they can be far more accessible to the citizens. So it's also very much about for the EU, for the researchers to gain high visibility and leadership within some of these areas. And as Emma mentioned, as a key part of the life science strategy is about building trust. Building trust is very, of course, in terms of cutting edge technology and how this should be implemented by the individuals. The trust for this is a key aspect for this destination as well. We're looking at 8 different topics here. 5 of them are coming with lump sum. 1 is blindly evaluated in stage 1. There's 211 million euros set aside for this across 4 REA projects, 3 CSA, and 1 innovation action. We expect around 28 projects funded from this. Again, we have a quite significant contribution to the life science strategy from this topic. The last destination we're going to talk about here is destination 6. It is all about the industry and the competitiveness of European health industry and also autonomy, of course. Again, with the increasing competition globally, this is seen as key is in the EU strategies. So this is all about ensuring that the healthcare industry within the EU becomes far more competitive and sustainable. It is about supporting cross-sectoral research within the health industry and also working more efficiently across the value chain. And again, citizens, healthcare providers, and health systems is the end users of these things. And again, you would really look at the trust as being a key part of this. So it's of course looking at very much about the industry, about the competitiveness, but it's also about ensuring that there's a clear benefit for the healthcare systems and for the citizens and providers. From destination 6, we have 3 topics. 2 are lump sum budgeted and 1 with blind evaluation. Budget is 83.4 million euros set aside across 2 REA projects, topics, and 1 EM. And we expect around 14 projects coming from destination 6. Yes, Emma?
Yes, and I will say something about the cross-cutting issues of Work Program 2026-27. Across all the destinations in the work program, there are a couple of cross-cutting issues. I will shortly mention them here. If you have any more questions, please get back to me and Lasse after the webinar. It is especially policy alignment with EU priorities, societal impacts, for example, promoting prevention and strengthening system, innovation, uptake and translation, how to get from research to real-world health solution, use of digital data-enabled health research, how to leverage European health data space and AI, and lastly, preparedness and resilience, which is a core focus also in this work program, building on pandemic lessons and addressing future health threats. Then I will shortly get on to the European Life Science Strategy, so we also have time for Pablo's case. In July 2025, the European Commission launched the new European Life Science Strategy. It sets out coordinated actions across the life science value chain to boost innovation, market access, and competitiveness in Europe. The Life Science Strategy aims to strengthen Europe's leadership in life sciences by boosting research, innovation, and their translation into societal and economic value. The key component is boosting research and innovation by improving funding, supporting multicultural clinical trials, and strengthening the research ecosystem, including advanced biotechnology and sustainable bio-based technologies. It also set out to enable faster market access for new life science products by processing the Biotech Act. Lastly, it increasing uptake and trust in new technologies by mobilizing dedicated funding, boosting public engagement, and coordinating policy across sectors. This strategy also emphasizes on One Health approach, integrating human, animal, and ecosystem health, stronger global competitiveness, and alignment with broader EU goals on sustainability and economic growth. The key focus points in the strategy, which is also supported by a lot of the topics in the work program, is development of an investment plan to further funding of clinical trials. It aims to create and develop a network of Center of Excellence of ATMPs. And lastly, to develop the EU Biotech Act to further innovation by simplifying the regulation and support the innovation and development. Expect from the already mentioned topics, there are some key areas in the work program which we have also mentioned through the deep dive of the topics and the destination, but especially the CSA topic in Destination 1, improving the public trust and outreach efforts within life sciences, and the development of Center of Excellence for ATMPs is very key in this work program. Now I will give the floor to Pablo, and I hope that you still have some time, but you can also just use the time you need. And let me know when I need to change the slides.
Okay, thank you, Emma. Can you hear me?
Yes.
Okay, perfect. Thank you very much for the invitation and for this interesting webinar. When I would like to present my case, a successful application into the Horizon Europe program that happened a couple of years ago. I was introduced, I'm associate professor at Aalborg University, working at the Department of Health Science and Technology. So I will start, please, next. Please, next slide. I will start introducing to how this started, the whole thing. Of course, yeah, there was these events where we can know about the topics, and I was interested in this specific topic that you can find in the portal, for example, bioprinting of living cells for regenerative medicine. That was part of the Destination 5, actually. And then when you find that that there is a topic that is matching your research field, you start to wonder, okay, is it something for me, and could I be a main applicant on one of these topics? And it requires actually changing a little bit of your mindset, because in the beginning you probably will think, because it's an overwhelming amount of information you have to read, especially if you don't have expertise in this type of calls, that you think that this is not something for you, or this could be impossible. But with help of people that is expert, for example, people from your fundraising office in the university, or also the national contact points, you start to realize that the impossible could be possible, actually. And then once you accept this challenging endeavor, you start to get more into the topic and the destination, and you realize that is actually something that you can deliver. The next, please. So what you actually expect from entering as a coordinator in one of these Horizon applications? Well, actually, there is a lot of advantages on being a coordinator, even if you turn out not to be successful. I would say that it's really enriching the learning process throughout the whole application process. It happens that it boosts your network quite a lot, so you start to have a much broader network that you had before you started the process of application. And then you need to know that there are a lot of support opportunities, and I'm going to get back to this in the next slide. But it's about a lot of support opportunities from your network, from your university, and also from the national contact points. And of course, there are some disadvantages or cons that you need to know, that this will require a lot of time from you. There will be meetings and more meetings that you need to participate, and you need to read a lot of information to get actually well informed about what is the topics that you are trying to apply to. And you need to know also that there is a relatively low success rate for this kind of projects, depending on the call. And the one that I was participating, you can see that there were a total of 81 applicants, from which 37 passed the threshold and only 6 got the grants. And that means below 5%. But it could be variable, but in general, it's not above 10%. The next, please. And when talking about the support that you should expect during the application process, I will say that it depends which stage of the preparation for the application you are. Initially, when you need to understand the call, there is a lot of support, and especially for, it can change from university to university, but we have a fundraising office that provides quite a good service on trying to understand the call, making all the logistics and the intelligence of the call. Trying to bring all the information necessary to see if it's something that fits actually your profile. And there was also some meetings together with the people at the ministry, also providing some information like this kind of seminars or written information that help understanding the call. And then during the writing process, when it starts, we have to rely also on local fundraising. And one of the things I would recommend, especially if you get to get this EU Upstart grant to get support, economical support, either from the ministry or from your faculty, is to apply for an external consulting firm. We got actually a small amount to apply for writing the impact section, which is actually very important to align with the rest of your application. And then for reviewing and feedback, this is important that there are a lot of reviewing and feedback throughout the whole process, and you should get support from the relevant actors or parts of your network. And this is depending on your university. It might be local fundraisers or also within your own department. And one thing I should not forget is that your colleagues also can support you very much during this process. And about funding, as I mentioned before, there is this EU Upstart that you should apply in case you are going to participate in these calls. But in some cases, we have minor fundings from department and faculty that help, for example, buying you out from teaching, for instance, to get to write these applications. The next, please. This is an example of what was the timeline for my application. And when I say that it requires a lot of time, it does actually. You can see that I started the whole story reading about the project ID in March 2023, and the application was in 24. So it took about 1 year. So it doesn't say that you can do it in less time, but it's actually all the maturation and what you need to do to get the right consortium gets a lot of time. So when as early as possible, get the EU Upstart, and then you can form your initial consortium with few partners that you have as a part of your existing network. But then you need to collect more and more partners that maybe will fill some of these competences that are necessary to deliver the expected outcome impacts. The next, please. So what are the main challenges I faced during the application? And I think it's important for you that are going to embark in this endeavor. It's first of all, understanding all the new vocabulary that it's associated with an Horizon Europe application. You need to understand the difference between results, outcomes, impacts, and especially understand and read carefully all these destination documents. It's very important, so you align your application to what are the strategic plans within the EU. Then you also learn one of the challenges was to focus on a concrete and relevant problem, because given that you have a large number of partners, for example, in our case, we have 12 partners in total, everyone might want to go in a different direction or broaden the scope of your application. And then you need to, for instance, try to get to the right size of the scope of the project, so you don't promise too much, but also you are within a concrete solution that is doable within the time frame of the project, and it can be delivered on time. And then another challenge was to build a well-balanced consortium where all the different partners participating could deliver what is important for this to get to the outcome and impacts in the long term. And some of the most challenging partners to get into is the industrial partners, especially if you don't have them in advance. So I had a lot of different meetings with potential industrial partners. It's difficult to convince them that this is an interesting project, especially if you don't know them. But it helps getting through the partners that might have connections to existing industrial partners, and that's important. And don't forget the interdisciplinarity and the gender balance, which is a very huge part of the evaluation. The next, please. So as to finish up, somehow the take-home message from me as a successful applicant will say that you should take the chance. Don't think that is because it's overwhelming the amount of information that you need to prepare, that is impossible, but it is actually possible when you get the right tools and the right support, especially if you start early and you start planning early and do from the beginning, get the right things in place. Use all the available support tools from your local fundraising supporters, your colleagues. Get a nice consulting company. And then there are also some available support tools at the AU level that can help you drafting and getting to the right application. And then every detail counts is somehow a sum up that you won't make it if you have some few things that are not matching, because you need to score maximum possible points in order to be competitive here. And when I say every detail counts, one of the examples is that in some cases these topics in the description say it should contain this or it should contain that. It actually means it must contain that or it must contain the others. So be aware of these things, and use your network and use the fundraising support, the tools that we have available. And thank you, and I will be happy to answer any questions.
Thank you very much, Pablo. Thank you very much for this brief intro to your process and your good advices to some of these coming coordinators, hopefully. We have a few minutes left before we finish. So now today we've given you sort of a very brief intro to the work program, to the destinations. The European Commission, of course, will host the Info Day next year on 10th of February. So I really urge you all to sign up for this. It's an online event where they will go into to details on each and every topic. So please do sign up for this. It's a very important Info Day. There is also, and Pablo just mentioned that he had a lot of meetings in trying to find the right, especially industrial partners. There is also a brokerage event arranged in combination with the Health NCP Network, HNN 3.0, European Commission, and Enterprise Europe Network, a broker event at the end of January next year, where the exact purpose is to try to match up potential partners, also industry. Registration for this opened already 2 weeks ago or so. So if you are looking for partners, if you are an industrial potentially partner that want to find a consortium, you can have a look at this brokerage event where you can also submit your case in trying to find new partners. And with this, I think we will finish for today. Very an overview of this Health Work Program 26-27. As mentioned in the beginning, you will get slides and video and the recordings. You are, of course, most welcome to contact Emma and myself for more information, for discussing some of the topics you might be looking at. So take care for now. Bye bye.